The most interesting thing that I found out about the Australian system was the collaboration between public and private hospitals and the way in which they coexist in a limited space. And this allows for a differentiation of the offer, as is public hospitals are dedicated to emergency and acceptance department and the organization around urgencies, whilst the private sector mainly focuses on elective surgery.
The system is very well organized and structured. It's a patient-centered model. The way they organize their health professionals is very efficiently. They have a lot of staff to ensure the safety and quality of care.
The Sun Hospital, because with its 520 beds, is the most comprehensive hospital we've seen in the private sector. And being a teaching hospital, it allows young doctors to do also pro bono work in less developed countries.
Northern Private Hospital in Melbourne, who belongs to Ramsay Group. It is a good example of this kind of cooperation between public and private providers. There is a development project where they have settled a private hospital and a public hospital linked together in order to get the best efficiency capabilities. Vocera system, which is a technology for the internal communication between nurse and physician we saw in the Ramsay Hospital that led the hospital to manage at the best the emergency.
I too would say Vocera for what Gaia said, but also the call between patients and medical staff. This reduces the noise that a ward might have and gives all patients a better recovery experience because there is less stress involved in their stay.
The use of time was a value added in that we had the chance and the opportunity to visit both acute, post-acute mental health as rehabilitation centers. And another factor that I really appreciated was that we were informed with booklets and documentation about the healthcare system here in Australia before we arrived. So we had the time to study and be prepared for what we were going to see during our mission.